Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Wednesday, April 29th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Brad, thank you, and good afternoon. I want to start by speaking about the 4 workers and 1 child that have tested positive for COVID-19 at one of our 7 emergency childcare centres. City staff and Toronto Public Health took immediate action to close this facility once the workers tested positive, and they are continuing to investigate why this happened and where it happened. When I first heard of this incident, my thoughts immediately turned to the frontline families who will be affected by this and who we created these childcare centres to help. This first incident in one of our emergency childcare centres is a sad reminder of the dangers of COVID-19 and some of its continuing unknowns. And it's a lesson for us all as we make plans to reopen and try to get back to normal in a safe and healthy way. As part of the investigation, I've asked that we determine exactly what happened here and how we can strengthen the already stringent procedures we have in place to try and keep COVID out of these childcare centres. I can assure the families relying on these childcare centres and the people of Toronto that the very highest standards were put in place from day one to try to prevent this kind of outbreak, but obviously we have more to learn, as is true of so many aspects of this virus. As you know, City Council meets tomorrow to discuss the ongoing emergency and to deal with any urgent business. For the first time in history, we will meet in a virtual manner. I expect we'll meet again every few weeks to address urgent items so that the City Government continues to get the job done for our residents. As I said last week, I will be asking City Council to extend the emergency so that the City Government can continue to be flexible and ready to deal as quickly as possible with anything that COVID-19 might throw down in front of us. In the course of tomorrow's meeting, I will also be asking City Council to endorse a modular housing initiative that will see the quick creation of 110 supportive housing units ready for occupancy early this fall, and then 140 more supportive housing units, a total of 250 units by next year. The full capital cost for Phase 1 of this pilot is estimated at $20.9 million. Funding would come from the City's Development Charges Reserve Fund for subsidized housing and from the Canada Housing and Mortgage Corporation through its Affordable Housing Innovation Fund, in which it will, through which it will invest $8.25 million in grants and recoverable loans. And I'm grateful to CMHC and to the Government of Canada for this assistance in this unique project in the history of the City of Toronto. I'll be working with the Province of Ontario to secure from them the operating funding for health-related support services and housing subsidies so that deeply affordable supportive homes can be delivered at the 2 sites and delivered at wartime speed, something I'm totally confident that we can do. This is a good example of how all 3 governments can work together to help people and to get affordable supportive housing built quickly. I believe supportive housing is one of the best ways in which we can help people to move from homelessness into permanent housing. But you need the spaces built, and modular housing is our best option to get good quality units built in weeks, not years. I believed this before the pandemic, but given the crisis, the need for more supportive housing delivered as fast as possible has become even clearer. That's why I asked City staff to move this forward at an urgent, record pace. And that is why I hope Council will agree and approve the first phases of this plan at its meeting tomorrow. We are doing everything we can as a City Government to confront homelessness and to help people. Starting today, City staff are helping people living in encampments to move into 2 buildings with a total of 125 apartments that we've been able to mobilize for temporary housing through an innovative partnership between the City and the Times Group, which is a development company. As you know, we stopped clearing encampments during the initial stages of the pandemic, but those encampments have grown. And beyond the regular public safety concerns which existed with the encampments before the pandemic, they have now begun to raise serious public health concerns about the risk of COVID-19 spreading in these large groups where there's often no physical distancing. We're offering people in the encampments a temporary home in furnished units with on-site supports, including meals, 24/7 staff, harm reduction support, and long-term housing support to help bridge people into more permanent housing. Some have already moved in today, and many more will move in the coming days. 40 of the units were furnished thanks to donated furniture and housewares from Dell Suites, and I thank them and the Times Group for their cooperation in this endeavour. Health and safety will be a priority at this site, with active and ongoing screening for COVID-19 and enhanced room and common area cleaning. Access to units will be prioritized for people in encampment sites that present health and safety concerns and are identified as higher risk to COVID-19 related harms. Our goal here is to house people. Our goal is to house people. And as we succeed in housing people, as people move into these units, encampments will be cleared by city staff. Like everything we're doing right now, this is about the spread and preventing the spread of COVID-19. I hope these will be a healthy and safe path to housing for people who need it right now. Today, the city also announced that we are closing High Park starting tomorrow for the duration of the cherry blossom bloom. We made the difficult decision to close the entire park because it is the only way that we can keep people from gathering. I asked city staff to go the extra mile to see if there was a way to avoid closing the entire park, but no matter which way you turned, there was a prospect of a crowd scene at many blossom vantage points throughout High Park, and this in turn meant that there was a risk to public health in people gathering together and being at close quarters, given the spread of this virus to date. That, in turn, would be an unacceptable result for us that we are contributing to through allowing this kind of thing, the spread of this virus at precisely the time when we're trying to wrestle it to the ground so that we can return the city to a more normal circumstance. I know this decision will be particularly frustrating. We've already heard from some of the local residents who use the park daily for exercise. Thank you, I say to them, for your ongoing understanding of the fact that we are following public health advice. We are placing the health of the public and saving lives first, and we appreciate the sacrifice you will be asked to make over the next few days. Annually, some 10,000 people show up to see the blossoms, and we cannot risk even a small fraction of that group coming together during this key point in confronting COVID-19. We'll be delivering virtually the experience of the blossoms blooming, and doing so in many different ways. Starting today, the city's Bloom Cam will provide a continuous 24/7 live stream of the blossoms so that we can all still see these beautiful signs of spring, originally gifted to the people of Toronto on behalf of the people of Tokyo. Beyond the Bloom Cam, there will be several other virtual experiences at toronto.ca/cherry blossoms. And so I invite you to go there. I think you will find many things that are of interest and many things that will allow you to experience the blossoms. Look forward to experiencing them again in person, hopefully next year. And I will just say that the pulling together of all of these different parts of the cherry blossom experience virtually has been as a result of the hard work of many people on our city staff and the partners to the city. In particular, I want to thank the Toronto Public Library Bookmobile, which has been loaned to us for this experience, to Rogers for powering the internet connectivity needed to bring this year's High Park cherry blossom bloom into the homes of people across the City of Toronto. I would also like to thank Toronto-based Indigenous film production company Denizen Pictures, photographer Phil Sutherland, and artist Rihanna Niceforo for their contributions to the city's virtual blossom experience. The cherry blossoms will bloom again next year, and I look forward to seeing them in person with Toronto residents at that time, hopeful that by then COVID-19 will be confined to the history books and to the medical journals. Throughout this crisis, I've called on the federal and provincial governments to work on helping residents and businesses who've been hurt by the economic impact of COVID-19 to help both residents and businesses with their rent. The federal and provincial governments have taken action to help businesses, particularly small businesses, with commercial rent relief, and that is a good thing, and I commend both governments for their cooperation in that regard. But as the first of the month is once again approaching, I think it is important for me as Mayor of Toronto, with so many people living in multi-unit residential rental buildings, to reiterate my call for residential rent relief for those who need it. The province did take action early on to put a pause on evictions, and that too was a good thing undertaken by Premier Ford and his government. But I know there are tenants out there who need the federal government to work with the provinces, including the province of Ontario, to do more. Again, if you are a tenant who can afford to pay your rent because you've kept your job and your circumstances are much the same as they were before the pandemic, please do pay your rent. That will help landlords to be better able to help your neighbours who can't pay their rent right now because they may have lost their jobs, for example. I join with Minister Steve Clark, the Minister of Municipal Affairs and Housing for the Province of Ontario, in urging the Government of Canada to work with the Ontario Government on a residential rent relief program. In the meantime, while I recognize that the circumstances of all landlords are different, big and small, I can't think of very many instances in which landlords can't work with their tenants to offer some form of short-term rent relief, even if the amount deferred is paid back over the balance of the months remaining on the lease. Now is the time when we need everybody to work together to help people, and I hope the two governments and landlords will be able to work with tenants to provide some kind of relief for them as we approach this next important beginning of a new month. Helping people stay in their homes is so important right now, and it will help avoid putting further strain on frontline efforts underway, some of which I outlined today, to help vulnerable people in Toronto and in cities across the province. So that's my update for today. I know it is on a variety of topics, but I wanted to provide a complete update on all of these issues for the media and for the residents of the City of Toronto. I want people to know that their city government is working non-stop and working with other governments and with nonprofit partners and with the private sector to help them through this emergency, to keep delivering essential and critical services, and to make sure that we continue to address the major issues confronting every big city, including homelessness and affordable housing, every big city across this country and indeed across the globe. These are issues made all the more urgent by COVID-19 and its ravages. As we're hard at work on a sensible, safe plan to relaunch the city's $300 billion economy, this too is occupying a lot of our time these days at the City Hall and beyond. This is not a simple task. It's an important task. We will need your help. But if we all work hard to get to the day when we can begin to implement that plan, we will get it done. And now I would like to invite Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. For today's update, as of 11 o'clock this morning, there are 5,360 people infected with COVID-19 in Toronto. This includes 4,845 confirmed and 515 probable cases. There are 354 people in hospital and 111 in intensive care units. In total, we have lost 347 Torontonians to this virus. As always, I extend deepest condolences to those who have lost loved ones and wish a speedy recovery to those who are sick. I remain concerned about the devastating impact that COVID-19 is having on our community and our most vulnerable residents, in particular, people who are experiencing homelessness. Today, the city's Shelter, Support and Housing Administration announced a new program to provide interim housing for up to 6 months and other supports for people experiencing homelessness. This is welcome news. Affordable, quality, and stable housing is important for good health and overall well-being. People who enjoy stable housing conditions with supports that are appropriate for their needs are best positioned to lead their healthiest, happiest, and most productive lives. Housing instability is associated with a range of poor mental and physical health outcomes. Improving health status and reducing health inequities are two of our main objectives in public health. One of the most powerful ways in which we can achieve these objectives is by ensuring stable housing for all of our residents. This is why, as your medical officer of health, ending homelessness in our city is one of my top priorities. We are currently facing challenging circumstances. At times like this, I think it is important to remember that even when things feel overwhelming, there is always hope. We see this hope reflected in the many ways throughout our city, including creative leadership demonstrated by some key organizations. For example, the Toronto District School Board and the Toronto Catholic District School Board are known for creating exciting new learning opportunities for their students. While schools may be closed, the important business of learning is still open. Our local school boards are modeling the way by practicing truly inspiring examples of physically distanced learning for their students and their school communities. I've heard of so many powerful examples, and while it's difficult to name just a few, some examples that have stood out for me include online music classes and virtual sing-alongs so that students can join each other in song, live on video. Art, video, and writing projects so students can thank frontline workers for keeping them safe and share positive messages. Holding student trustee elections online and providing opportunities for students to participate in leadership roles in their own school communities. Online weekly math challenges so students can tackle and learn new math skills and share their math strategies with each other. Offering daily reflections for students online. Virtual spirit days so students can show their school pride by dressing in school colors and sharing photos. And donation drives providing food for people in need. In addition, many teachers around our city are getting creative in showing their students that they care. For example, sending virtual birthday wishes, setting up neighborhood reading buddies so that students can read books together over their backyard fences while maintaining safe physical distance. And a gym teacher cycling around the neighborhood dressed as the school mascot, encouraging students and their families to stay physically active. These are just a few examples of positive leadership in extremely difficult times. Sincere thanks to the Toronto District School Board and the Toronto Catholic District School Board and the many others who are finding ways to stay connected while practicing physical distancing. Your actions are reducing the spread of COVID-19 and saving lives in our city. I encourage all of us to find inspiration in these positive examples so that we can all lead the way for our children and for our city. In the meantime, please continue to stay home, stay safe, and take care of each other. I'll now hand it over to Chief Pegg for his remarks.
Excuse me. Thank you, Dr. Davila, and good afternoon. Today marks the 50th day of continuous EOC operations, 44 of which have been at level 3, which is the highest level of activation. This is the longest continuous activation of the city's EOC to date. Since March 11th, all aspects of EOC operations have continued to operate 7 days per week, ensuring that both critical and essential services are being provided without interruption, and that the safety and needs of both our residents and staff remain a top priority. As issues and challenges arise, they are readily identified and addressed through our incident management system. Last month, the EOC worked in collaboration with Toronto Employment and Social Services, the Province of Ontario, and other city partners to facilitate the in-person distribution of Ontario Works and Ontario Disability Support Program payments at various locations across the city. a robust and responsive distribution plan was developed and implemented that effectively maintained physical distancing during the in-person distribution of payments and replacement payment cards, while enabling our clients to receive the support they require. The April payment distribution plan builds on the successfully implemented plan used in March. While approximately 718 Ontario Works clients were required to attend in person in March to receive their supports, only 16 clients are expected this week. This is the direct result of our ability to successfully convert the vast majority of clients to direct bank deposits and payment cards, as opposed to providing manual checks. This proactive measure contributes significantly to maintaining effective physical distancing. Ontario Works support payments will be delivered and processed over 3 days this week, from Wednesday through Friday. Ontario Disability Support payments will also be delivered and processed on Thursday and Friday this week. This cross-divisional collaboration ensures that those who need Ontario Works and ODSP assistance have access to the supports they require and that they receive these supports in a safe and effective manner. This is one of many examples of how our team is collaborating to support our residents when they need it most. I would like to thank each and every member of our City of Toronto team who continues to work hard in support of our residents each day. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief Pegg. Before we go to questions, just to let everybody know that we have Shanley McNamee, our General Manager of Children's Services, on the line, Abby Bond, who's Executive Director of our Housing Secretariat, Marianne Bedard from Shelter Support and Housing, and Paul Raftis from Senior Services and Long-Term Care. Go to questions now. Please remember maximum two each. We go to Austin Delaney from CTV. Go ahead, Austin.
Hi, Doctor, and Mayor Tory as well. If Dr. If you can answer the question first, I'd like to circle back to the Jesse Ketchum Childcare. What are your fears and concerns there, and where are we at?
Well, I think our concerns are always with respect to COVID-19 in our community at this time. We're concerned, and we were certainly disappointed to hear of the circumstances and disappointed to have to close the centre, because we know it was providing a much-needed service to essential workers in our city. I think we look forward to continuing to be able to provide that service, because we know how important it is as part of our complete response to COVID-19. We know we need to have childcare services available to those who are taking care of all of us as a component of our response to COVID-19. But in the meantime, of course, we send our very best wishes to those who are sick with COVID-19 now, and look forward to restoring service again.
Follow-up, Austin?
Mayor Tory? Mayor Tory, would you like to respond to that, please? Your fears and concerns?
I'm obviously deeply concerned, but I also know that this is a virus about which we don't know a lot as yet. We're learning every day. The medical professionals are learning every day. I am totally satisfied that the most stringent of standards were put in place from the beginning of the opening of these child care centres that we put in place to help our essential service workers to do their jobs. And I now am totally confident that our staff and public health officials and everybody else will be looking for anything else we might do in order to make sure this doesn't happen again, and obviously to make sure that the children and the staff that have been affected by this directly or indirectly are properly looked after and cared for.
Thank you.
Okay, thanks, Austin. We go to Haley Cooper now from News Talk 1010. Haley?
Hi, Dr. Davila. Hi, Chief Pegg. Hi, Mayor Tory. My question is for Mayor Tory regarding tomorrow's virtual council meeting. What online platform is the city going to be using for this meeting?
We're using the WebEx platform, and what we've done is we've had, for those who needed it, for example, in my case, I've used WebEx many, many times over the last number of weeks for meetings, but there are others who haven't yet had that experience. We've had a training program for them. Those who needed it were supplied with an iPad to make sure they could participate in the meeting, and so now we're just going to have to go through what the House of Commons went through this week, albeit on a smaller scale, to use the same rules we always use with regard to who can speak and when they can speak, and as usual, our speaker, Francis Nunciata, will try and keep everything under control, but I'm optimistic the meeting will take, I'm glad it's going to take place, and I'm optimistic it will take place in a productive and constructive manner.
And because the reason I asked is we heard a lot about privacy and security shortcomings, especially when it came to Zoom. The head of Zoom even acknowledged those shortcomings. So the WebEx program, are you confident that it's safe and those privacy shortcomings are addressed on this platform?
One of the reasons we chose to use WebEx for this meeting is because it had not experienced, at least in a public way, and I'm not aware of any other instances in which it experienced some of the programs that have been identified with some of the problems identified with other platforms. And so I'm optimistic this will work, that it will maintain. I mean, this is a very public meeting, and we want it to be as transparent and public as possible. So we're not worried in this case about privacy unless we go into an in-camera session, which I expect we probably won't tomorrow. But having said that, other concerns about the technology and its level of security, I think are satisfactory to us and have been addressed in a satisfactory manner, and I'm looking forward to our first meeting, and if there are flaws with it, then we'll have to look again. But this is the first time we've tried this, and I'm confident that we've done enough homework. Our staff are very capable staff, that it will work fine.
All right, thank you. We'll go to Stephanie Smythe now from CP24. Hi, Steph, go ahead.
Hi, everyone. My question is for Dr. Davila, and I'm going to go back to Jesse Ketchum just to ask about the long-term or the emergency childcare facility. When we first heard about it, everybody's eyes sort of raised, eyebrows rather, thinking, okay, this could be a dangerous setting here. We've had this outbreak happen now. We know it's an outbreak. I'm wondering if you could update us on the numbers, Dr. Davila, at that particular facility right now. We know, I think we were still awaiting results on at least one staff member and a child.
Well, I actually think that the most up-to-date figures may be available through Shanley and my colleague at Children's Services, who I believe is on the line.
Yes, we'll ask Shanley to address that. Shanley, go ahead.
Hi. In response to your question, so we've had 4 staff members and 1 child that has tested positive for COVID-19 from the Jesse Ketchum Childcare Center. Another child was tested and the results came back negative, and we're awaiting 1 additional test result for a staff member.
Okay. My second question is, and thank you for that, to Dr. Davila again, is it fair to say this pandemic is becoming a story not as much about community transmission as much as it is in long-term care and congregate settings? And to that end, the contact tracing that public health has been doing, what is that telling you so far about the habits or what has happened with healthcare workers who have gone into those facilities? Besides, we knew some worked in more than one facility, but what are you learning about the people who work in those facilities and then went about their lives and then went back in?
Well, that's an interesting question you asked, Stephanie. I think, as the mayor has already remarked, it's a new virus that we're dealing with, only discovered in early January. So there is indeed quite a bit of learning that is happening day by day as we encounter new experiences with this virus. What we know about transmission is that the highest risk is for those who have close contact with a confirmed case. And most notably, that's going to be in circumstances like a household, given the closeness with which people live, in a house, and given what we understand of the nature of spread. We know that this disease is spread by the respiratory droplets that come from your nose and mouth when you, in fact, are sick or have an infection with COVID-19, and you're close enough to somebody that they are actually exposed to your respiratory secretions or droplets. So we know that that happens most often in households, but we also know that that is going to happen in certain settings, certain congregate settings. Healthcare would be one of them, and long-term care would be another, just given the nature of the care that is provided in those settings. So we will continue to observe. We continue to do contact tracing. That is a significant part of the public health response. And as we assemble those data together, we will use that to inform the next steps and actions, particularly as we move and start to look towards things like recovery and reopening, about which we've been talking for the last several days.
Okay, thank you. We'll go to Mike Crawley now from the CBC. Mike?
Yes, hi. I guess this is for Dr. Davila. We understand that the city sent a memo to the staff at Jesse Ketchum saying that masks were not needed at these emergency childcare centres, and this was in mid-April. Can you explain what the rationale would have been behind telling childcare workers that they didn't have to wear masks, and couldn't masks have helped prevent the spread of COVID?
So we know that masks can prevent spread, particularly for people who know that they are sick with virus. I think when we were looking at, and I know that we have worked very, very closely with our colleagues in Children's Services in order to provide the best circumstances for this very necessary childcare. As I've mentioned earlier, providing childcare to allow essential workers, including healthcare workers, to continue to provide their very important and necessary services is an important part of the COVID-19 response. So at this point in time, we have provided the best available advice based on the best available evidence in order to provide that child care in the most sound, safe, and healthy manner possible.
Okay, my follow-up on a different topic. You just mentioned in answer to Stephanie that about the highest risk being in relation to close contact settings. Looking ahead to the weekend, it looks like the weather's going to be very good, and I'm thinking of these concerns you've raised about people walking on the lakeshore. What's the evidence that you have about the relative risk of transmission in outdoor settings that informs these concerns that you have, and how do you respond to the criticism that the messaging you've been saying to people to stay home and not go for walks outdoors is actually undermining public goodwill and even people's mental health?
Well, I can appreciate that this has been a very challenging situation. That's not, I experienced that too. This has been an incredibly challenging circumstance, I think, for all of us. But from what we can gather based on our data, we have actually seen the positive impact, as challenging as the circumstances have been, of physical distancing. We have been able to significantly reduce transmission in our community as a result of that. But as I've said over the last many days, and as you've heard other levels of government and their public health officials saying the same thing, we must continue to stay the course if we are to do the best we can in terms of saving lives, preventing illness, and ensuring that our healthcare system is still available for us when and if we need it. So I would encourage people to continue to stay the course, to continue to practice physical distancing, as challenging as it is at this time. We're all extremely eager to get back to, something more like what we used to experience prior to the appearance of COVID-19. And my understanding and the best available science tells us that we will get to that day sooner the more we are able to stay the course right now.
Okay, thank you. We'll go to Mark McAllister from City News. Mark?
Another question with regard to Jesse Ketchum. I think we're kind of touching on the point of the system that's been set up and the protocols that have been put in place. I think the big question is how the virus has entered into this space. Are we talking about the potential of the parents, these essential workers, carrying it in through their children, and then the staff catching it at that point? Could you explain the possibility and how it might have entered this space?
Well, thanks for the question. I don't want to speculate at this point in time. These are cases that were just recently discovered and have come to our attention, so they are the subject of an ongoing public health investigation and work that is being done, yes, by Toronto Public Health, but in concert with our colleagues at Children's Services. As we continue that investigation, we will learn, as we have been throughout the past several weeks, how to live safely with this virus as best as possible and infuse those lessons learned into our ongoing practice. But for now, I think we need to let the investigation proceed, understand what the circumstances might have been, and then take action as necessary.
How can the essential workers that have been utilizing these facilities be assured that the proper protocols are in place if the staff, and now at least one child, has tested positive?
Well, I think it's that's an interesting question. And when I think about, a number of the essential workers who are making use of this childcare service and the other facilities that are currently in place around the city, many of them are healthcare workers and understand that the kinds of things that are being put into place, the protections that are being put into place at the childcare centers are actually quite similar to that which they see within their healthcare facilities. And those protections, those measures that are being put into place are based on the best available science that we have in regards to this virus at this time. So we are continuing to learn. We are always assessing practice and trying to do better and better each time. I can assure you that that is our practice at Toronto Public Health. I know it's our practice, or the practice of my colleagues at Children's Services, and you can be sure that we will continue to function in that manner.
Thank you. We'll go to Beth McDonnell from CTV News. Beth?
Hi there. This question is for Dr. Davila, and it is about hospitals. Can you talk about what an outbreak means in a hospital, the risk, and what happens once an outbreak is declared at a hospital? If there is a reason for alarm, why or why not?
Well, whenever there's an outbreak of an infectious disease in hospital, we are certainly engaged as the local public health unit. But I can tell you, having worked with many of our hospital partners over many years, our hospital partners have very well developed infection prevention and control standards and teams that they use all the time in order to try to make hospitals the safest place they can be. By their very nature, hospitals are treating individuals, many of whom will have infectious diseases. So there will always be some amount of risk, but that risk is mitigated through the various infection prevention and control practices and through well-established outbreak management practices that we have. Both, that's the hospital and Toronto Public Health, as we work with our hospitals to deal with outbreaks as they arise. All premised on the best available science and involving those who have specialized training in infectious diseases and in infection prevention and control. So while there is concern always when those situations arise within the context of a hospital, I think we can rest assured that knowing what I know of our hospital partners and their practices and knowing what I know of how we interact and collaborate with them, the best available science is being applied to those circumstances.
Thank you. Thank you.
Okay, thank you, Beth. We'll now go to Jennifer Pagliaro from the Toronto Star. Jen?
Hey there, I wanted to ask Mayor Tory, just on rent relief. I had asked you about this yesterday, and I wanted to know sort of what's changed since then, now calling on the federal government to work with the province, and if you've had a chance to have any discussions with either of those governments at this point.
Well, I've had discussions in the preceding weeks about this, recognizing the City of Toronto itself has no jurisdiction. In fact, the jurisdiction rests in the purest terms with the provincial government, but I recognize as well that if there's going to be a robust program of any kind to provide relief, it is probably going to have to be done similar to what was done for commercial tenants and landlords, which was a joint federal-provincial program. But I think, you know, the way in which we're going to get this resolved in the most effective manner is if every landlord just decided that they would sit with every tenant on the residential side, those who are concerned about this, and reach a pragmatic kind of arrangement, as has been done many thousands of times, I know, across the city, and just do something as simple as to defer the payment of rent and spread that deferred rent payment, say, for May 1st, over a succeeding period of weeks. But nothing has changed. I've been talking about the need for relief for some time now, and I just am being realistic in saying that most of these large programs that have taken place, especially in areas of provincial jurisdiction, have often required some degree of federal help in order to make them big enough and effective enough to get the job done for the people that are meant to be helped.
For Dr. Davila, or perhaps there's someone else who can tell us, how old was the child at Jesse Ketchum who tested positive?
So if I'm correct, the child in question was 8 months old. Is that correct, right, Shanley?
Go ahead, Shanley.
That's correct.
Thanks.
Did you have another question, Jennifer?
No, that's it. Thank you.
Okay, thank you. Final question to Matt Bingley from Global News. Matt?
Hi, I'm just wondering if someone can provide a little bit more clarity on just how this whole situation at Jesse Ketchum played out. Can you take us through a bit of a timeline of who presented first, if they presented symptoms in this facility, or exactly just how this was sort of found out?
We'll ask Shanley McNamee to answer that first.
Sorry. Hi, can you repeat the question? Sorry, my speaker turned off.
That's okay, Shanley. I'm just wondering if you could provide a timeline of exactly how all this sort of played out, like whether it was a child that presented symptoms first, adult, if they were at home, if they were at the facility. Can you just give a little bit more clarity on this?
Yeah, initially that we had a couple of staff who called in sick. So our practices that we have in place are that if staff have any symptoms or feel ill at any time, they should not report to work, and they should call in and report that they are feeling ill. So we had some staff do that, and we recommended that they go for testing. We had a child, the child that did test positive did not have any symptoms when they were screened into the center. So every staff and child is screened in before they enter the facility. That child did not present with any symptoms the day that they were there. However, the family let us know later that the child had presented with some symptoms, so we asked them to go and be tested. So essentially, any child or staff member who arrives at the center is screened in. If they present with any symptoms at all, or if they present with symptoms throughout the day, they would be isolated and leave the facility. So these were folks calling in after the fact or before presenting to complete their shift to let us know that they were ill.
And to Dr. Davila, I'm just wondering, of the 58 other children who are being told to, well, I guess their parents are being told to isolate, are their families required to isolate as well? And will there be any procedures changed based off of this event so far?
So at this stage, what happens is that when we have cases, we identify who their contacts are and provide advice to those contacts appropriately. So those close contacts of cases are asked to quarantine in order to minimize the risk of further transmission. However, this is very much an active investigation still, and so any next steps, any further actions that will be taken will rest on the complete investigation, or at least further steps in the investigation having been taken.
Okay, thank you. That concludes today's briefing. While there is a council meeting tomorrow, we do intend to hold this briefing again tomorrow at 3:45. Should that time change, we'll let you know. Have a nice evening, everybody. Stay safe.